This morning we have Blake Derksen from the Bounty Chills Health Center with us. Blake, thanks so much for coming.
Thanks for having me.
And for those that might not know, you are a Southern Manitoba guy. You said you grew up in Plum Coulee.
That's right, yeah. Plum Coulee born and raised, and living here in Winkler now. So
you work over there at the Bounty Chills Health Center in the palliative care wing. Can you talk about what you do with palliative care?
Yeah, so I'm a palliative care nurse. I work specifically with palliative care patients, registering them within our program and then following them along their journey within the hospital. And that works alongside our regular healthcare team, like the nurses and the doctors who are on the floors and running around doing all the grind. But we are specific to patients who have end-of-life situations, whether that's a terminal illness or an illness that's going to cause negative effects to their daily life, and try to provide support and symptom relief for them.
And you being there at the Bounty Chills Health Center is a part of the foundation, as your position is funded by the BTHC Foundation.
That's right. Yeah, my job there is only exists because of them. So I'm funded by them, as well as a few others within our palliative program and our spiritual care provider. And so, like I've often mentioned, that we're lucky that we have this program within our building. There's not a lot of facilities around here that have specific palliative care nurses and a program so dedicated to it. So that's all because of the foundation.
And the Bounty Chills Health Center Foundation, they're all about patient care, and that is a big thing with palliative care, where you're taking care of patients and their families.
Absolutely, yeah. Like I said, we focus in on their symptoms and their goals and their comfort, and often that comes along with families as well. So caring for the loved ones and the cared people and their families too, so that everybody feels supported and so that they can set their minds at ease as far as the pain and potential suffering part, and just be present for the one that they care about. So.
And what kind of feedback have you heard from patients or their families from the care you guys are able to give at palliative care?
It's always been very positive. Palliative care is a hard time. End of life is a hard time. And sometimes there's a lot of emotions that come along with that. And we try to be, a soft comfort while they're going through that. And I've heard lots of good things. People are happy that we have this program. People are happy that we have nurses like myself and Eunice who can pop our heads in and take the time to listen and take the time to work on some of the other things that the healthcare team might not have all the time for, or might just be too busy for in certain days. So it's appreciated. Those moments are appreciated, and the specific focus that we have always seems to be very welcomed.
And you mentioned that thanks to the foundation, you guys are able to accommodate a lot of different patient needs when it comes to where they want to be.
Yeah, the foundation not only allows us to work, but they provide a lot of other little comforts that the hospital may not have had without them. So certain furniture, certain equipment, iPads that we got this last year to allow people to do video chats, because, visitors are sometimes hard to come by. And all of those kind of things to help this journey be as, soft and caring as it can be.
And as people are getting ready for the season of giving, this is the donation conversation.
Absolutely.
What message would you have for the community to be a part of the conversation?
Yeah, well, I first want to thank our community for being so supportive over the years. We have a great program. Our foundation works hard for us, and we really appreciate that. But I would encourage anybody around here to, if they're able, to consider donating to our foundation. They do a lot more than just palliative care, but in my world, they make it possible for me to have a job that I enjoy and to provide care for people. Well,
Blake, thanks for joining us, and thanks for all the work that you do.
Thanks for having me.